It's been actually amazing today, talking about different topics that affect communities and also what's happening in different communities as well, and also internationally from Indigenous groups.
I'm here today to talk about healing from an Indigenous perspective, particularly Māori, and utilising our Māori ways of working, our frameworks, to heal people. This meeting house is the essence of Wairua for Te Arawa.
Key points for me were, one was thinking about all of the acute mental health issues that sit out there that we respond to, but underlying that there's just so much both trauma and social emotional well-being, so broader kind of issues as opposed to acute mental health issues, and these are the kind of things that drive unwellness in our communities. It's not necessarily the big chronic diseases, it's not necessarily psychosis, it's people coping.
This is my first International Initiative on Mental Health Leadership conference, and it's been great so far. I think it's really important for us to remember that part of our process is also healing, so hearing the stories from others.
Good. So the only place that is the biggest employer is Nunbai, and Nunbai that creates jobs for Aboriginal people.
If you're talking about the empowerment of one, or you're talking about the empowerment of a group or a community, first of all you've got to work with them. You empower the individual.
You have a strong individual, makes up a strong family, makes up a strong community. It's the way that things are done back within each community. Whatever is done has to be done in a culturally appropriate way.
We know, as Aboriginal and Torres Strait Islander peoples, and have known for a long time, our social emotional wellbeing, our healing.
The presentation was on social emotional wellbeing action plan of the Queensland government. It was launched in late last year. It's a new plan. It brings together actions across the Queensland government to improve social emotional wellbeing of Aboriginal and Torres Strait Islander peoples.
We were looking at some of the frontline issues that were confronting Indigenous communities, and they are a shared struggle. So it's things like, high rates of suicide, culturally inappropriate services and service models, engagement of community groups in whatever program or service that gets delivered to them. And those are shared things across all Indigenous country or Indigenous people in different countries.
The Wharerowantik Declaration is the work of a number of Indigenous leaders that have come together within an international context to really talk about advancing a vision around healthy communities and Indigenous leadership. It's important to acknowledge that Indigenous leaders need to be the ones that are really advancing and articulating this vision and around influencing positive change within our health systems.